A break from social media, saying it's detrimental to his mental health. Joining us is Dr. Andre Newfield, Chair of Psychiatry with Hartford Healthcare St. Vincent's Medical Center. Dr. Newfield, is this a growing trend?
Unfortunately, it is, Lisa. We see that studies have been showing that when it comes to our body image or our depression or anxiety in general, social media seems to be having a detrimental effect.
All right, is this something that more people should consider doing, and if so, why?
Well, we don't like to generalize because everything should be decided on a case-by-case basis. But in general, yes, because of what the studies are bearing out, we are seeing that there is evidence that social media is having a detrimental effect on our mood, our anxiety level, our body image, and therefore we should start to consider, the impact it's having on ourselves or our loved ones, and consult our partners, whether it be our psychiatrists, our therapists, or just our general practitioners, to determine what's right for us.
All right, doctor, tell us about some warning signs maybe that we should look out for with ourselves or with our children.
Sure. When it comes to any bad habits, you want to look at excessive time being spent on those certain things on our devices for social media in this case, or away from those important things that are vital to our lives otherwise, whether it be exercise, whether it be our academics, our work, our chores at home, taking care of our kids or cleaning up, all of those things that we might be taking time away from. And then, of course, signs that it's affecting our mood, interfering with our sleep. But sleep is a big one because when you're taking extra time to do those things, it's going to be cutting out sleep time. So certainly things to be aware of.
All right. What is your advice to parents to convince kids to maybe take some breaks from social media?
Yeah, the hard thing about parenting is that some of it is going to take some convincing and some cooperation. And sometimes you just have to draw a boundary and set an expectation and say, I'm sorry that we disagree, but here are the rules that we want to lay down in terms of how much time per day or what times of the day we want to do it. We find that from studies, waking up early in the morning and turning to social media or turning on our devices can be detrimental to our health. And certainly right before we go to bed, we probably want to take a break from that as well. And then parents want to ask whether opening up Pandora's box and letting your young children onto social media right away is the best thing to do anyway.
All right, great information. This is a topic we're hearing more about as time goes on. Dr. Andre Newfield, Chair of Psychiatry at St. Vincent's Medical Center, thank you very much for being with us.
Thanks so much, Lisa.